to Diabetes India, who invite me, and not first time. And in many years ago, my friend Saukat Shadikot invite me first time in Diabetes India. And after this, I every time say Diabetes India is the best conference in the world, because it's true. And you know this. And also, I would like a big thanks to to you colleagues for participating in our session, because you're interesting to this education. Patient, it's crucial roles for their life. I also patient with type 1 diabetes. I know exactly how change life through the education. But I will speak about very important and relevant topic, addressing medicine shortages in diabetes care in humanitarian setting. Medicine, we know, most clinical cost-effective health intervention. A lot of people use medication, and it is growing. But medicines can only be an effective intervention is accessible, available, and constantly supplied. Medicines shortages are common among healthcare providers worldwide, increasing alarmingly. Common shortages includes drugs for conditions including diabetes and epilepsy. This is a and why I would like to speak about this because it's a lot of now is very I have already said that it's relevant questions. It's a lot of organization put attention on this problem, and you see European Medical Agency are also expert of this organization, and also FIP, FDA. And a few weeks ago, I listened some Great Britain Parliament, and they also put attention on these medicine shortages, and they say that 80 different drugs in more than 30 therapy areas were affected by shortages. This case is a very important question. Cause of these medicine shortages are multifaceted and complex. And if you see it's different issues, supply issue, demand issue, regulatory issue, management issue, and if you see some deep manufacture issue, availability of raw material, and so on, it's a lot of factor which influence. But also we have already mentioned that factor influence to pharmaceutical supply chain. It's natural disaster and pandemic. We have already had this experience. Political and monetary abilities. Trade war. Now it's new, like trade war. Military conflict, which have already Jackie mentioned. And why we speak about this? Because it's big influence and big impact to patient care. Disruption and delay in patient treatment, increasing stress and anxiety for patients. And we know that this is associated with self-management. This could be worse. Increasing potential risk of health clinical complication. Medication safety issues due to the wrong therapeutic alternatives, medication error, adverse drug reactions. Increasing mortality, of course, like consequences. And time, we spend a lot of time for looking for some medicines. Health costs include extra hours spent by healthcare provider and also by our patient. And increased treatment costs and patient out-of-pocket costs that Jackie mentioned before. But I would like also put attention how this shortages not depend which case through the humanitarian crisis like flooding in Brazil or Ukraine, like war, conflict, war. And also it's in Netherlands, which make questionnaire spread to patient. They also same point. This is stress and anxiety for patient, panic, and so on. And I would like to share to you my experience that through the conflict, we immediately increase needs shot into insulin because maybe due to stress. And we have three-level policymaker addressing shortages. And you see the various causes of drugs shortages suggest that different strategies are needed to addressing existing or potential shortages. You see, it's different. It's like must be combination, depends of factor, which cause. This was study show that different strategy, like proactive strategy, like sharing of resources, a strategies alliance. This is input to realize resilience strategy. Sorry, and this also reactive strategy. This is combination show that how this help to mitigate these medicine shortages. But also, I will not deep. I only want to show that depends of course different strategy we use for mitigate. We cannot stop, but we can mitigate medicine shortages. And of course, WHO also make a strategy. And what I would like to emphasize, of course, regulatory, manufacturing, but I would like to pay attention education and training. This includes also not only. This is my red line. Add for you because it's not in the WHO mitigation strategy that we must also education and training of patient and a person who live and few years in war are understanding how it's important to be prepared, then got this lesson through this experience. And also training for family doctor we organized by our this like example what we did in Ukraine, and also medicine consultation of doctor was by the telemedicine. And you see, it's a lot of documents now, development by regulatory, for example, in Europe. I mentioned this Europe now. And they have shortage prevention plan. They have also public information on medicine shortages. And they have also catalog. And then you can go to this catalog and find some country and see which medicine shortages could be. But even a few weeks ago, we had meeting in EMA and understand that it's also gap communication and it could be also late. This case maybe big focus. We must pay attention of communication. How clinician can respond to manage medicine shortages, of course, you know this. Switch to different brand to some medicines. Can you do this? Yes, but maybe you have not another option. This is problem. And use alternative dosage form another which you have. Yeah, it's possible. Switch off to different medicine. You have guideline, you know what is strategy, you know what is first line, second line, and third line. You can use this if you have. And access unregistered medicine product if this come to your country through the humanitarian aid. This is you can use. If you lucky, if you have this chance to, but it's also we must remember about our patient, because this is if you switch to another brand or medicine, you must explain how to use this. And give competence also to patient. This is education moment. I would like to share with you some guideline which made by American Association Insulin Product Switching Guide. This is I also participate in development these documents because when we was start, we have a lot of people displaced and go to different countries, and to every country who help us, and they need switch, and some doctors don't know what you have in Ukraine and what we can present. This is very, very useful document, and it was short and it's really in time. And they also it's not only used by doctor, but also sometimes need patient because they have not any capacity ask doctor. It's a very good point to education. When we speak about insulin, of course, we must speak, and the shortages, we must speak about temperature. And to be honest, what I have now in my fridge, some insulin which have already expired, but I cannot take away this because I am afraid all the time that maybe I will have not capacity to another insulin. And if you look on this research, show that you can use this, and also if it's even without a fridge. And now what we can do now, we have not electricity in Ukraine, and very short time, and how we can manage? Anyway, in this case, this is our product, insulin we can use, even if it expire or not in fridge, not in same temperature. I'm sorry. I did. Can you next slide? Because something happens. Yeah, and this, what as I say, please need to educate our patient. We don't know what happens, as you say. We don't know how we can prepare for flooding or something, but anyway, elements about how we can do and how we can response of some humanitarian setting, patient must be educated. And as you see, it's also prepared by Diabetes Disaster Alliance. It's prepared very good guideline, short, and you can use it. And another case, I'm pharmacist, and I'm very happy that in our audience, I have students from my university, from Zaporozhye. I think you guys have come. And pharmacists have crucial role in mitigation medicine shortages, because sometimes the patient have not chance to speak with doctor. And what is I see very good in Australia, they can propose some strategy how prescribe and by pharmacists also, and this helps to care. In Ukraine case, in the beginning of the war, we decided to change some rules. Of course, doctor prescribe, and person go to pharmacy and got insulin which doctor prescribe. But suddenly they must change because many doctors leave Ukraine and so. And when Vice Minister sent to me this new document about change law, and then pharmacists can give like not brand name, yes, but for example, Actrapid, yes, but pharmacists decide if what he have and what he can give to patient. And I was against. I'm pharmacist, but I was against. Pharmacists decide. I was against, and Irina, we have no time. And then I start communicate with doctors. What you think? Because it's like very short time. And Irina, better have this difference we can manage, but if we cannot insulin, this is problem. This case, okay, and we accept this rules, new rules. But to be honest, we are very happy that we had a lot of help, and this case will not change to brand. And also, I would like to underline about social media. This is it's about Lebanon. We speak about.
Dr. Irina, we are short of time.
And this how mitigate medicine shortages, because they have this terrible situation, and some people have not money. No, they must buy, and then a government gives some reimbursement for this, give some money. In this case, also a way for mitigate shortages. So thank you very much for